Okay, then I'll call the meeting to order. This meeting of the Neighbors of Dunn County Standing Committee. And the first thing we do is call a roll, and we have everyone here except Supervisor Breslin, so we have a quorum. Next. It's just Chris, okay. Next up, approval of the minutes. Any
Make a motion to approve.
Supervisor Leno, Supervisor Witzel? Any changes or additions? I guess not. So all in favor? Aye. Any opposed? They pass. Do we have any public comments? No public comments and nothing at the request of the chair. So we jump right down like we usually do to Carmen. Number 6.
Thank you. As always, we start with Quality Assurance Steering Committee updates. So we met last week for QA. The big topic that we had was the East survey situations that we had talked about last month. So we are working through that through our QA process and changes and things like that that we are working on. We also talk a lot about our safety plans coming up because it is the start of severe weather season. So our safety committee has been working to get prepared for that. One thing that we are required to do as a skilled nursing facility is have evacuation drills annually. So we do those in the spring so that we do them prior to the most likely reason for evacuation would be a tornado in our area. So we're working through that. So that was discussed as well. So far, we have done our tabletop exercise, which is a requirement. So we did that through Superior Health that had an online free simulation kind of thing that we worked through as a safety committee. And then in May, we will have our actual evacuation drill where we act as though a tornado had hit our facility and how we work through that process. Besides that, the other regular reports were given and there was nothing out of the norm for that. Any questions for QA?
No, let's move right on.
Okay, next I have Chris for employment activity report.
Good morning. Can everybody hear me?
Yes.
Yeah.
Okay, perfect. So in your packet was the employment report for February. Types of recruitment were the same as they generally are. We did do a couple of Department of Workforce job fairs in Chippewa, Eau Claire County. We did an on-site hiring event here. So we skipped down to number of interviews and such. Direct hire interviews, 8. We only did 2 agency interviews. Positions offered were 7. 2 with February start dates. 5 of them were March start dates. We have a orientation group today of 5, so that's a good thing. And positions offered higher than a step 3. There were 2 nurses that had started. During this period, we only had 1 part-time, very, very part-time CNA that had resigned, and that was due to school scheduling issues. And she's going to school out of the area, if I remember correctly. We go down to open positions, and those would have been adjusted with the new hires. We skip down to work comp lost hours, again, another month without any lost time. Missed shifts due to COVID-19 issues in February, roughly 30 shifts or 275 hours. And that includes missing hours of agency staff. So it was a good month.
Yeah. Any questions for Chris? Supervisor Witzel?
Just curious now, I don't know if this is a good time to bring it up, but with the 2 facilities that are closed, have you gotten anything from those facilities? Or people applying from those facilities?
Nurses,
Yes.
we're getting nurses from there.
Versus but not CNAs?
Mm-mm.
No
No.
CNAs? Okay, thank you.
Welcome.
Anybody else? Now, the open positions, I assume are all based on 8 households?
Yes, they should be for this year. I don't.
Yep.
8 households.
Okay, then let's move on to CNA training program. C.
Okay. So as I had shared last month that our CNA training program was starting in March, so we did have our first class start on the 11th. So that is currently going on right now. We have had some. Wait.
Excuse me.
We have had a couple of growing pains of just making sure that we have everything working out with the company that's doing it and things, and which is normal when you have two companies working together and things like that, of timeframes and making who's doing what for different things, such as laundry for the stuff they use and things like that. So working through all of those things, but all in all, it's going pretty well. And the first class is currently going on, and then we will have a second class starting on April 1st. And then looking forward to the summer, we're most likely going to have 2 time options. Right now, they're all evening classes to try to catch students after school and things like that. In the summer, we are hoping to have 1 daytime class and also an evening class. Since kids are out of school, it'll give them an opportunity to be there during the day, and then have 2 classes going on during the same time frame. So, so far, so good with that. We have had a couple of our own internal staff either start the class or planning to start the class on April 1st. So a couple of homemakers and a kitchen employee that would like to take the CNA course. So they're taking it with us.
So generally, how many people
Wait,
do
wait,
you
wait.
have in those? Excuse
Want to get the people at home to hear it.
Yeah, all right. Generally, how many people are in these classes at a time?
So the max we can have in a class is 8 if we have
Okay.
1 instructor. So
Okay.
that is per state law, that they have 8 students to an instructor. And so far, we have only had 1 instructor at a time. I believe the class right now has 6. So it wasn't completely full. I know we had actually one of our internal staff that was supposed to be in it. She deferred to the April start date because she had some conflicts. So it's not completely full with 8, but it is the first class, so we're hoping that picks up. I do know this company holds classes at facilities in both Eau Claire and Chippewa, and they almost always are full to their max. So we're hoping to see that in our next few classes.
Increases the pool then, so to speak.
Yep.
All right, thank you.
And how many weeks long are they?
So it's 75 hours of a course. So it kind of depends on how they set it up. I believe right now they're 3 weeks of the breakdown, but it's 75 hours is the required number for training for course.
And then you take internship after that, or how does that work?
Nope. So the 75 hours includes classwork as well as the clinicals. So then after that, they would then take their both written and their skills tests. So we are not a testing center, so they would have to find a place to take a test. That's a whole nother process to get certified as a testing center. So we're starting with just a class, and then they'll do the testing center, or they would test somewhere else. I know Dove and Eau Claire is a testing center, or they can really go anywhere in the state if they can find a test. And then they would take the written test and then also the skills test, and then they would be certified.
Okay, thank you.
How about financing? Do they pay for it themselves? Do they have the state one, or how's it work?
Sure. So most of the people that are currently doing it are doing it through Wiz Caregivers Career Program, which is the state funded program. So actually how it works is a little funky. So they register through us as a Wiz Caregiver person. And then we pay for the class so that it gets going quickly. And then we get reimbursed through the state. So that the employee doesn't have any costs at all for that. I know we do have one person, I believe, right now that is like a private pay, for lack of a better term, that didn't do the Wiz Caregivers. And then if someone that works at a different facility, say it's a kitchen staff from ALH, and they sign up through them for Wiz Caregivers, they would pay for the class, even if it's at our facility, and then they would get reimbursed. So whichever facility that the individual chooses when they sign up as their, as their employer, I guess, is how they pick it. And then that person gets, or that company gets billed.
Do they have any requirements to work any place then after they go through this?
Yes. So then they would work at the facility. I believe it's currently 6 months, Chris, is that right? Yeah, 6 months requirement to work there.
Work where?
Wherever they had whoever paid for the class. So it's not necessarily us. So if say, yeah, so if say ALH had someone register for our class, they would have the requirement to work at ALH for 6 months. So if they register through us though, then they would have 6 months with us.
As we're moving forward, if you have what we just referred to as private pay, is there thought on we would pay for it with some kind of 6-month requirement of work or something like that?
It's something we could look into. I don't foresee many people doing the private pay. We've really encouraged the WIS caregiver career programs, and I believe the workforce or the company, the workforce training program, also strongly encourages it. So they said that it's very rare that they have a private pay person. But if we start to see more of that, that's something we can look into.
And
Thank you.
how much is the cost then for the whole CNA training?
Chris, you have the exact number, don't you? Every class is different.
Yep, $535.
Thank you.
Yep.
Mr. Supervisor Lino?
Yeah, just a quick question do you see a rash of people like doing musical chairs, so to speak, after that 6-month time period? Or do they generally stick around?
The hard part is a lot of these people are student age.
Oh,
So we
okay.
typically see them while they're still, if they're a high school student, we see them while they're still in school.
Mhm.
College student, same thing. Sometimes the thing that we do get though is if there is a high school student that then graduates, they come home for the summers or work over Christmas break and things like that. So sometimes come back later. The last time we did the WIS Caregiver Careers Program, I think we only had one person that the day they got, at that point, they were doing bonuses was part of it. The day they got their bonus, they left. I think that happened once. So we don't see it as a huge situation.
All right, thank you.
Mhm.
Okay.
Yeah, I didn't notice.
Okay, then let's move on. Any further questions on the CNA? Nice job, Carmen. And Laura, you're here too. Resident referral report, D.
All right. So the resident referral report, in February, we started the month with 101 residents. We had 82 referrals. We had 14 admissions, which is a little bit higher as we are seeing more ins and outs in having Fireside open. Now that we've had Fireside open for about 4 to 5 months, open in April. So that number continues to get higher as even if we're not filling it to full capacity, they're short-term people, so there's in and out more admissions, things like that. We did have 68 people not admitted to the facility. At the end of the month, we had 105 residents. We had 0 residents transferred to another facility. We had 2 deaths and we had 8 discharges. So our top referral sources, this has changed a little bit as you won't see Sacred Heart on there anymore. So Oakleaf and then the 2 Mayos. Oakleaf has become a bigger referral source for us, which I would speculate has something to do with HSHS as they're having more people go there for things that they probably hadn't in the past. So we are seeing more people come to us from Oakleaf. And then the Mayos have always been a consistent provider for us, which normally is Menominee, and then Eau Claire is typically people who were sent from Menominee to Eau Claire. So
A quick question. I see number of residents not admitted.
Mhm.
Could you elaborate on that? You know, being a new member on
Sure.
the board, what exactly does that mean?
Sure. So it means someone who was referred to us from one of the hospitals, most likely,
Okay.
that we did not admit to the facility. So in years past, pre-COVID, we had broken down the reasons that we didn't admit people, whether it be that they were above our weight limit, that they didn't have a payer source would be one of those. So they didn't have insurance, they weren't on Medicaid, we had no proof that we would be able to bill them, things like that. sometimes behavioral or psychiatric needs if we aren't able to meet their care, things like that. Then when COVID came around, the majority of the reason that we don't admit people is we don't have beds. We had COVID outbreaks. We just weren't able to admit people. So when that situation happens, if say we don't have a bed available because we are full to our current capacity or we have COVID outbreaks, we're not necessarily even reviewing those referrals, because if we can't take them, we send it on and just say we can't take you right now. So that's why we don't have the breakdown anymore, because they might have been a perfectly fine referral, but if we don't have a bed, we can't admit them. So
Room in the inn.
yeah.
And one comment, now that it's a really big number.
Yes.
And before it was maybe in the teens,
Yes.
Okay,
because there weren't that many referred.
all right.
Yeah, so we are seeing huge numbers of referrals still. I think some months are up above 100 in each for a month of people referred, primarily because there's a lack of nursing homes, as well as everybody's in the same boat as us. So other people aren't accepting referrals. And then for Dunn County specifically, it's us and ALH. That's it. So in total, there's 170 beds in the county. So, and we're 137 of them. So
Okay.
there's not a lot of places for people to go. So we're seeing this is basically everybody that needs a place to go. So.
Thank you.
Supervisor Lyon.
What is the weight limit?
It's 350. And that is simply due to our equipment. It is the weight limits for, actually the one that has the lowest weight limit is our toilets. So all of our equipment is bariatric equipment. We do have bariatric lifts. All of our beds are actually bariatric beds at baseline, but our toilets are the one that has the weight limit of 350.
Okay, just one thing to confirm, especially with Barb and Tim here. We're still letting people in based on staffing. So
Yeah.
if we don't have enough staff, we're not letting them in.
Absolutely.
So that means not a lot of overtime. We're not doing a lot of forcing people to do shifts. Are we doing some?
There is some. The only time that typically occurs now is if there's a call-in. So if it's our only option, we have had that with night shift nurses a couple of times recently, that there isn't a ton of extra night shift nurses. So when someone calls in at 9 p.m. for their 10 p.m. shift, because they're sick or something happens, we have had to mandate staff to stay, but not at baseline for regular scheduling. So we've been pretty good lately about having enough staff on the schedule and everything like that. It's just if we have, especially if there's like 2 call-ins on the same shift, it puts a little bit more pressure on it.
And just a reminder that they can do it voluntarily.
Correct.
And they can do a voluntary ahead of time and they get a bonus then, right?
Correct.
So it's something that they've worked on. Okay, great. That's D. Next up, Scott's report.
I will give Scott's report
Hey,
today.
Scott.
So I'm not actually sure where he's at today.
Carmen,
but
I'm here.
Oh, you are here.
I just finally got on. I was having technical difficulties this morning.
Oh, that's okay. Go ahead.
Yeah. Hi, Scott.
Good morning, everyone. Just in the nick of time, I guess. Find my notes here. All right. So I wanted to report, one thing is, after the replacement of the garage doors in all 3 buildings, I did take the old doors as we planned and put them up on auction for sale in Wisconsin surplus. We did recoup some money on those. The central door sold for $515, west door sold for $255, and the east sold for $260. So we recouped around $1,000, a little over $1,000 on the doors.
Yeah, great job.
Yeah.
Thank you, thank you. We got the new bus delivered, taken care of. It is in process of getting licensed. I got that submitted into the DMV. We do have a temporary plate on it. We do have the insurance on it. It actually was taken over to Eau Claire today. Today and tomorrow, we'll get the graphics, the neighbors of Dunn County name put on it. That'll be taken care of. So, should be all ready to go. And then, work forward with, if there's any training needed on using it. I know Alyssa was looking at, the books for it and familiarizing herself with all the wheelchair fastening straps and all the works of the bus. So it is great to have that in working order or in process. The next thing will be getting the old bus all ready to go for putting up on Wisconsin surplus auction. And hopefully we can recoup some money out of that. Hard to say, it's low miles. Somebody might be interested for at least the drivetrain out of it. So hopefully we can do that. Aside from that, we're in central survey. I just can report that the life safety part of it, we did get one site. There was a candle in a bathroom, so that the staff had left in there for decoration purposes, had never been burned, but that is something that's against the code. We can't have a candle in the building, whether it's burned or not. So, other than that, Brady did a great job with the, survey, with all of his notes and everything. The state engineer did compliment him on his paperwork. And he was making notes as we went through survey with her, making notes on how he can improve everything and get things better for more efficiency. We did have a situation where a hole rusted through one of the pipes in the dry sprinkler system so that it was leaking some air pressure. Company was here this week and worked on that, get that replaced and fixed up, ready to go. Other than that, I know Brady's been working on some issues with water pressures in houses that is causing an issue with some water temperatures. So he's working through getting all that taken care of. Aside from that, working on work orders and hopefully we don't have any more snow because we got that too and this week, and the guys did a great job of getting everything cleaned up and pushed away for that. Any questions?
Yes, Corley.
I was gonna say, did we give the bus a name?
Yes, they did.
I
They
mean,
did.
a lot of names. I sent in a name. I don't know what anybody else did. I sent in a name.
Yes, there was a name. Carmen, would you like to elaborate on that?
Sure. So I guess we'll just kind of cross off G2 because bus update was down there. And Scott shared the majority of it, but the name is going to be Chuck. So the story behind that is Chuck Osman is one of our activities professionals at the Neighbors. He has worked at the Neighbors or the Dunn County Healthcare Center for many, many years. He started over here in the laundry department, and then went off to school and came back and has worked in the activities department ever since. And he is a staple of the Dunn County Healthcare Center and the Neighbors, and very beloved by residents and staff. It had an alarming number of votes. Nothing else was even close. So it is named after Chuck. So the bus is going to be Chuck.
All right.
Hmm.
Can I just add, oh, go ahead.
No,
Yeah.
that I had the same question.
Just add a little bit. I saw Chuck out somewhere else and someone asked, are you going to retire? And he said, I'm of the age I could, but he said, I just love it so much.
Oh,
I've made so many relationships with the families and the people.
mhm.
So boy, those are the kind of people that, yeah.
Yeah, no kidding. Yeah.
So great. Oh, and while we're there with the bus, wonderful job with the open house with the bus and the publicity and having people come out. And you were out there, weren't you? Oh, I thought you said you were. Okay, but people were coming out. It's wonderful.
We're very excited.
Okay, so we got done with Scott. Thank you very much, Scott, if you're still there. Appreciate it.
I'm still here. Thank you. And Carmen, sorry for stealing your thunder on the bus.
It's all good.
All right, thanks.
Okay, let's go down to F then, the survey update.
Okay, so we actually have a couple things to update on survey. So I'll start with the East survey situation that we had talked about last month. Just a brief update. So we did do an informal dispute resolution regarding that survey citation. So how that process works is that we submit a dispute resolution, basically all the paperwork and a narrative of why we are contesting the citation. It gets submitted to a third-party organization, and then they set up a conference call basically that includes the facility, the state, and then this third-party organization. And then I have a chance to basically explain and give a statement of why I think that we should not have been cited, basically referencing back to the actual regulations and comparing what was done, what the regulation is, and why I did not believe that our facility should have been cited for that citation. That process is about an hour is what the time frame they give you to explain that. And then they say thank you and you'll be hearing from us. They do not give us a time frame of when we will hear back from them. In the past, it has been very quick. I think the last one we did this past fall, we heard back within 3 days. This call happened. It'll be 2 weeks tomorrow, and we have not heard back yet. I am cautiously optimistic about that because if they were just like, nope, you deserve the citation, I think that would be the quick response. So to me, I'm being optimistic that they're looking at it deeply and seriously considering our appeal. So just kind of waiting on that one. And hopefully I'll have an update by the next meeting for that. I would really hope so, considering that's a month out from now. And then in terms of the actual survey part of it, so anytime we receive a citation, we have to do a plan of correction, and then the state has to basically certify that that plan of correction was completed. So in certain situations, they do what's called a desk review, where they just basically take our word for it. We send in the information and they say, okay, you're in compliance, send a compliance letter. In other situations, this being one of them, they come out and do what's called a revisit survey. So it's unannounced. Sometime after you submit the plan of correction, they will come out and just look at just that. So that happened last week. We had 2 surveyors. One was in training, and they came out and were there for a couple of hours and just reviewed our plan of correction and said that we were in compliance. So it's interesting because they do all of those steps, and then if we were to win our IDR, it was all kind of unnecessary, but they still have to do all of those things. So either way, we are in compliance for the East building, and that is all complete and done. And then we're just waiting for that IDR response at this point. Any questions about the East survey before I move on to Central?
2 hours seems like a long time, girl.
Oh, that is a very short survey.
Oh, really?
Normally surveys, so an annual survey is 3 days, 3 full days basically. And then typically a complaint or an investigation survey is a day. Revisit surveys are normally about a half a day. Life safety code surveys can range from a few hours to a full day. Our actual complaint or investigation survey for the East situation was 2 full days. So it kind of just depends on the situation, but it also was one of the surveyors was in training, and it was one of her first revisit surveys too. So I know that that always takes a little bit more time too. Any other questions about East? Okay, so Central. We had our annual survey in the Central neighborhood this week. So they were here Monday through yesterday. We had been patiently waiting for them because they were at their limit of time frame for their window. Surveys have to happen every 9 to 15 months to keep the licensures. So they can happen as soon as 9 months after we had last had them, but the latest they can come is 15 months after we last had them. And I think we were at 14 months and 2 weeks. So we were patiently waiting for them. And they came on Monday. There was 4 surveyors, which was a lot for 20 people. Currently, Central Census is 20 residents. So having 4 surveyors for 20 people is a lot, but it's okay. Last year, we only had 16 residents when they did Central Survey, and we had 4. So I'm not really sure they're planning on that, but for reference, we normally have 3 surveyors for a full building of 45. So not really sure why, but so they were here Monday, Tuesday, Wednesday. It all went very well. And then Life Safety Code was here on Tuesday, which Scott already mentioned with the 1 citation regarding the candle. And then for the health side, we only received 1 minor citation. It was just that a care plan for CHF, which is congested heart failure, wasn't done at the right time frame. The individual had other care plans that mentioned CHF, so nothing was done inappropriately with the resident's care or anything like that. It was basically a paperwork glitch. So it was fixed before they left, and it was an isolated situation. So it was cited at a level D, which is the lowest citation level that we can get. And for reference for new members of the committee in surveys, when we have an annual survey, they look at everything. So the kitchen, nursing care, social services activities, basic paperwork stuff. They look at closed records, admission process, discharge process, literally everything that we do. And then they issue the citations afterwards if they find any. And for reference, the state average is around 7 citations per survey. So we are very happy with our 1 tiny citation. Any questions on that? Okay, our next annual survey will be the East Building, which last year was in the end of August, early September. So we were anticipating not having another one through the end of summer, which is wonderful considering I will not be there for part of the summer as well as Laura. So we were very happy to just be done with annual surveys until we're both back from leave. So. Any other questions for that?
Okay, so that would be F then, and we did the bus. Supplemental, this is H, supplemental payment
Yep.
update.
Okay, so I think I've talked about supplemental payment a couple times since our new members have joined us, but just as a quick recap, supplemental payment is an additional payment from the state for Medicaid residents based on being a county or municipality owned home. That is basically, it dates all the way back to DDE unit times and things like that, where county homes are typically known for taking more difficult residents and taking people that don't have other places to go. So it is a supplemental payment that is given to county homes to help with the Medicaid deficit. That is a system that has changed many times over the past few years, and they're trying to figure out the best way to do it and have the payments come out in a fair manner as well as a timely manner. And they've kind of tossed around a few new ideas. So it was brought to the Wisconsin County Homes Association, which we're members of, a couple of months ago regarding a proposed change to supplemental payment. And they asked for our opinion on it. The facilities had very mixed opinions on it, which we shared with the state. So we're not sure where they're going to go. We basically shared our vote, for lack of a better term, of what each facility liked, didn't like about the new option, and then we'll see what the state does with that information. They have typically been pretty understanding in the past, for lack of a better term, of what we would like from the supplemental payment process. They'll give us options, and they have been pretty good about going with what option the county homes want. It doesn't necessarily change how much money each of them gets, but just how it gets processed. And The option that they're going, or that they were proposing, was instead of doing two large sum payments every year, typically or historically, it has been a payment in the summer in the end of the fiscal year in June, and then a payment at the end of December. So those two payments come through and they're typically split in half. And then that's the total supplemental payment for the year. The proposed idea is having it actually be in addition to our rates so that it would be a payment when every rate gets paid. So the only downfall to this, and it would have affected us this year if we had that, is that it doesn't give way for the appeal process. So these payments are based on our cost report, which cost reports are appealable currently. So, and we did that this year. So we appealed our rates because we did not think our cost report was done accurately by the auditor. We thought there was some issues on that. So by us appealing our rates, it would have affected our end of the year payment in theory. So if we're getting paid the same rate every day, for lack of a better way of explaining it, they're not going to go back and back pay you or things like that. So it gives issues to making sure it's accurate. So if the cost reports and all of that is accurate the first time, the system would actually be a lot better, in my opinion, because it's consistent and it's not just one lump sum that may or may not come. But it does also have some problems with, we've had cost report issues over the past couple of years. So we kind of went middle of the road on it. There was, one of the options was having this start April 1, which is one of the quarters for the state quarters, or start at the start of the fiscal year, or stay with what we've been doing before. So we voted for the start at the start of the fiscal year on a 1-year trial basis was our idea, to see how it went. We did not want it to start April 1 because we did have rate appeals out there. So that could still change, which I'll get to a little bit later. But we did think that it would be worth a shot. Supplemental payment has not been great the last couple of years. This year, we did not get any supplemental payment. So change could potentially be helpful. So that was the thought process.
Why didn't we get one this year? I mean, we're eligible for it, are we not?
Yes, so how it works is that there's a $30 million pot of money that then gets divided between all of the county homes based on Medicaid loss. And per our cost report, it said that we did not have a Medicaid loss this year, which we did not agree with, which is what we appealed.
Mhm.
Okay.
Mhm.
Okay.
So normally when you get this supplemental payment, it is 10% of our cost, 20%? What kind of percentage does this make up?
So I can make sure I have the number correct off the top of my head. So the supplemental payment is actually, if you are on your financials, we have it budgeted for 2023. It was budgeted for $1 million. It's the intergovernmental change.
Oh, intergovernmental. All right.
Mhm.
All right. Got it.
So,
That's nothing to sneeze at.
no. So, and every year it has gone down, which is what we can expect because the rates have gone up. So the idea is not to just keep adding more money into the system. It is to even the score basically between Medicaid. So if our rates go up, we won't see supplemental payment. If we're getting paid enough up front,
Yeah.
we wouldn't have that back pay. But this coming year, I could see that as our rates have gone up. But for the cost report from last year, we still had a pretty significant Medicaid loss. So it didn't compute of why we didn't. But there was 12 county homes that did not receive supplemental payment this year.
Sounds like we're balancing the budget on our backs, so to speak.
Okay, no public comment. Barb,
How many county-owned homes are there?
I believe right now it is 32. There has been some change. We've had a couple close and a couple that are in the process of closing. So roughly around 30.
Around 30.
Mhm. There's been, in the past couple of months, there's been 3 that have either closed or been in conversations about closing.
And,
across the state.
and how large are those?
I don't know off the top of my
Okay.
head. I know Sauk County is one of them. I don't know how big the or like how many beds it is. Washington County was one of them. And then, oh, there's one other. I can remember the administrator's name, but not the county. But so there is three. There's
Okay.
three that have been in conversations or have announced closures. I know Sauk County, I believe, announced closures but isn't closed yet. And then same with the one that I can't remember. They are officially selling, but it hasn't been. So they're actually not closing. They found a buyer to sell, but it won't be a county home anymore.
Okay. Thank you.
Any other questions on supplemental payment?
No?
Hopefully for next month, I will have an answer of what they decided. We gave them basically our thoughts and then the state was making a decision. Based on the fact that I haven't heard anything yet, I'm gonna have an educated guess that it's not starting April 1.
Yeah.
But you never really know. So that's a potential, but my thought is that I think most of the facilities were okay with the idea, but having it start July 1 at the start of the state fiscal year. All right.
Letter I.
All right. So I just wanted to give kind of a brief update as we're getting closer and closer to me not being here of just who's covering for what and kind of the plan going forward. And I know it's a little bit interesting timing since this committee could be completely different. So it might not be all of you, but just as a thought it would be a good thing to just discuss quickly. So my anticipated date is May 13th. So I will still, knock on wood, all things go well, still be here for our April meeting. And then depending on when, if the meeting dates change or anything like that for May, might be possible for that as well. In terms of covering for board reports and things like that, while Laura is still here before her leave, she will be covering for those reports. If there is a meeting where neither of us are here, Chris Corpla did say that she would be able to help out with that as well. If there's anything going on with that. In terms of financials, Jane is still going to be doing all of that while I'm gone. And then she's also helping for coverage for like invoice approvals and things like that. Because there are quite a few people that submit invoices to me for approval, including Laura. So it's a little bit hard because she can't approve her own stuff. So finance will be approving all of my invoices that I would normally be approving. So vouchers will still come through, all of that will still happen. And besides that, the majority of the things that you all see will be the same people doing those things. So in terms of board involvement and committee involvement, it should be pretty smooth. But if there are any questions or concerns while I am out, Laura or Sarah Lasowski, our director of nursing, and then if obviously Chris, if there's employment things, stuff like that. But just wanted to give a little bit of a update in case there is something that needed attention from any of you while I am not here. I'm trying to be as prepared as possible.
Thank you.
Any questions at all on that?
No, looks good.
Okay.
All right, so we have finished with your report, and now we're down to number 7, consideration for action to be taken by the committee. Review of vouchers and financial reports.
So unfortunately, you're gonna have to listen to me talk a little bit longer. Jane is on vacation this week, so I will be doing my best to go over these. And then if you have any questions that I can't answer, I can always hand them off to Jane too, and we can get back to you. So because we are still at so early in the year, we are not doing projections yet for 2024. That was something we had learned last year that we had issues with projecting out too early with the major payments and things like that, that it caused a little bit of panic because it made financials look a little wonky for a couple of months. So getting a full quarter under our belts first is probably the best way to project out for the year versus a month or so. So right now we would only have through February's financials since March is not done yet. So after the end of March, so next month, we will have 2024's financials. So this is really just a recap of what we talked about last month. There are some things that are in there that are different as final numbers have come in, bills being paid, things like making sure all of the transfers come over if we have something that got paid in 2024 but was a 2023 charge, things like that, making sure that we're doing all of those adjustments. And so you can see the overall financials. So this is what we are coming out at looking like for the year. The audit firm is here right now doing our cost report audit. So as you, well, maybe some of the newer members aren't aware, the Neighbors has a separate audit every year from the county audit. So it's the same audit firm that does the overall county audit. But they do an individual audit just for the Neighbors, which is how we get our cost report, which has to be submitted for each building to the state, and that is how rates are then set. So they do that early because there is an early deadline for cost reporting to the state versus the deadline for the actual county audit is later. So they're here right now. So after they're done with that audit, this number could potentially change a little bit, just because that's kind of their job of what they do is cleaning all that up. So the audited numbers could be slightly different. In addition to that, have some good news as it comes to rates. We actually, as some of you might remember, but I believe this was prior to our newest members joining us, we did a rate appeal from our rates that we received in the fall. We receive rates several times throughout the year. Our rates that we got in the fall for our east and west buildings were lower than what we had anticipated, partially due to some allocation issues. With the setup of having 3 buildings, each building gets a different Medicaid rate. And that is based on the cost for that building might be a little bit different if we have a higher cost person, we have more staff one day, whatever it might be. It throws those off just a little bit, but they should be somewhat similar. Central's rate was very high, and then East and West were lower, and partially due to us splitting things in thirds. That means more cost is going to Central for less people. So we have been really cautious of adjusting that. So in years past, for example, like my salary was split equally in thirds to the 3 buildings. Now we're adjusting it to do 40, 40, 20, so that we have it more correctly allocated per resident, so that it doesn't throw off these cost reporting things, because basically everybody salary who is split, as well as some of the overall costs that were split, were being split unevenly, and then it looks like we're spending a lot more money in Central than we are in the other 2 per resident. So we've been cleaning that up. Jane has done a lot of work on making sure that that is the right way of how it should be. But through that process of our rate appeal, we actually did see an increase for both East and West. So we just got those rates in yesterday, so fresh off the press. For East, it increased our rate by $30.88 a day. And then for West, it increased our rate by $22.66 a day. And that's per Medicaid resident. So that's a pretty substantial increase. So both are above, I believe both are above $400 now per day for each resident. So that is a big increase for us, and we are very happy about that, because that will make a significant impact. Jane and I are still working out the best way to do this, as since the auditors are already here, all of those numbers are in. We already closed the year on if we can go back and really add those back into last year, even though it was accrued cost basically for that year, and we should have been paid that money last year. But it might be too late at this point, so it might just be added on to this year, if we can't go back and add it to last year. She was going to talk to the auditors about that because we're not really sure, if we can do that with still being within, the general standard of accounting principles. So, just making sure we're doing everything the right way. But really that $30 and $22 per resident day for those two buildings is going to add up to a fairly sizable sum of money that technically should be in last year's financials. So
If it's put into 2024, then will it affect our reimbursement?
it should not, no,
Should not.
should not.
Okay, thank you. That's good enough answer. Thank you.
I don't believe so because it wouldn't, it would still come out as a cost, for our, like, the cost of resident care will still come out the same. So I don't think it should have an impact. The only thing it could potentially impact would be that supplemental payment, but we already aren't seeing that right now, so I don't see it having an impact, but, sometimes you never know with the state, so
Yeah.
hopefully no.
And just one final, next time we will get, January and February.
I believe we'll have January, February, and March for next meeting.
Okay. And the reason we didn't have January and February is because the projection would look bad. We couldn't have just left it off. Huh? Okay, okay.
That-
As long as we get it next time. Thank you.
Yes.
That's it.
Yeah, that was something that Beata and Chris had talked about for all the committees of starting out year financials in after a quarter this year. So. And then the other things that are in her packet for this are the same as usual. So we have the agency staff financials, so that should be everything from the end of the year. So that should not change. Now, all the bills and all of that are in there. So we won't have any changes to that after the fact. Really, the only things that might change, I believe, are the money coming in. Money going out is completely done now. But money coming in could be a little bit adjusted, but the expenses are all in. And then we also have the campus census report. This is for this year. So it shows for January and February our census. So it shows the different pools of money that are coming in. So Medicaid, we have as a high goal, and we aren't quite at that goal this year yet. We are above for our private pay goal, which we had lowered as we anticipate less and less private pay. We had lowered that this year in our budget, just as we anticipate that trend to continue. Our private pay numbers have pretty consistently gone down as cost of care has gone up, and just the amount of people that have the level of savings that are needed to pay for the cost of care is just steadily decreasing as general life is becoming more expensive. So we did lower that to be conservative on our amount of private pay. So we are still above that. Veterans, we are high. We've had a lot of VA contracts lately. That one is kind of hit or miss. It's if we get people that are veterans, that number is high. If not, it's not. It's not anything we can really control, but lately it's been fairly high. Medicare has been good. We're not quite at our benchmark for that yet, but as we've had Fireside open, we've had quite a few Medicare residents. And then insurance is right basically on target. We don't normally budget for a lot of insurance as it's not one of our primary payer sources. We typically only have one or two people that are on like a Medicare Advantage insurance. All right, and then we have the aging report. So this is the same report. It does include January and February on here. January went down quite a bit, which was nice. We have it up a little bit right now. Over the next couple of months, we might have a little bit higher of an aging report. The system that does billing processes out into all of the other systems has been having technical difficulties across the state. So we have been having to do a lot of hand entry into billing systems. So that has slowed down the process a little bit. It is being worked on. We are fortunate because we do have access to get in and directly hand enter. There are facilities that may be like a newer facility that don't have access to do that because they never had to do that before there was a system. So there are some facilities that are currently not being able to bill. So we are actually pretty fortunate on that. I just talked to Jane about it yesterday. And she said that everything is currently going through. We aren't having any issues. It's all being billed. But she said it just might take a little bit longer. So this aging might go up a little bit. But it is all billable things. Any questions on any of that?
Okay, then, that'd be the financial reports, and now any questions on the vouchers from anyone?
I have a few, if I may.
Yes, please, Supervisor Lino.
Yeah, let me, just a couple things, under
A
administration.
little closer, so.
Oh.
people- It's just people that are,
I'd like to
Not
thank
here.
the Academy. Yeah.
what, how'd we get here?
Couple things right off the bat. First entry, Apostolic Publishing Company Incorporated for $192.50 for advertising.
Sure. So we do a few different advertising things. I believe that one was, we do an advertising for, it goes to the, farmer's market. They have reusable bags every year and there's advertising spots on them. So we have a neighbor's ad on those reusable bags.
Okay. Well, all right, that makes sense. And then, also I see here entries, for the state of Wisconsin Department of Justice.
That is for our background checks.
Background checks for employees.
Correct.
Oh,
So
Okay.
we have to do back.
Small dollar amount. That's why I'm kind of wondering.
Yes, they're pretty cheap. I believe they're $10 a background check.
Okay.
So we have to do those for all new employees, and then we also have to redo them every few years. So everybody is on a schedule to fill out a background check. I believe it's every 4 years. We have to redo everybody's background check. So
Right.
we just pay those whenever we get them through, and they're kind of sporadic.
Okay. I just saw that and I go, okay, how does the Department of Justice have anything to do? with our-
Yeah. Yeah.
what's going on?
I know.
And we have to do a specific caregiver background check. So it's a little bit different. So I believe it's us and DHS have to do those for the county. And it's very specifically, looks at things like abuse, neglect, elder abuse, things like that, that show up on there as both criminal charges as well as denials for working in caregiver settings.
Okay, you know, when we are getting cited for stuff, that type of thing, if in the event that we are cited and it has to do with either not necessarily neglect, but abuse, you know, that type of thing goes on the personal record of that individual, or is it just strictly on the organization?
That's a good question. So, when that happens, if we have someone that we think there is founded abuse,
Okay,
so it's not necessarily even if it's cited or not. So, say there is an abuse situation that happens, we go through the reporting process. We are required to notify the police, families, and then we notify the state of Wisconsin. The caregiver has to be removed from care pending investigation. And then we do a formal investigation. If we believe that there was some form of abuse that occurred, we report that to the state. And then they go and the DSPS, which is the basically workforce people that do licensures, they do investigations and then determine if it affects the licensure of the individual. Knock on wood, we've been very fortunate that we haven't had a situation that has gone to the point of removal of somebody's license, but it does happen. For example, there was a situation a couple of years ago where a facility in Chippewa had a nurse who was stealing money, and that individual lost their nursing license because of that. So it does happen. We've been fortunate that it doesn't happen for us. In the case that we have a citation, it would really depend on what the citation was about. So if we had a citation for not properly investigating abuse, it doesn't necessarily mean that abuse occurred, but if there was an allegation and we didn't properly investigate, we could receive an abuse tag, and then that may not affect the person because it may not have actually been something that happened. So it kind of depends on how the tag is written. If there is a situation that there was founded abuse, we received a citation for it, whatever it might have been,
Into the organization.
the organization.
All right.
If that is the case that there was founded abuse, it would be reviewed by the state for the licensure of the individual.
Okay. Now, what about, because we are dealing sometimes with abusive clients, are there situations where the employee is abused and do records of that abuse of the caregiver? Does that, I know I'm probably going way out on a limb here, but what happens with those types of records where somebody's being taken care of? They maybe inadvertently slap, hit, somebody like that. Are records kept of that in particular individual? And is there like a 3 strikes and you're out kind of
Yeah,
situation?
we are getting a little far away, but let's answer this one
Sure.
Okay.
and then go with it.
All
Okay.
right.
So yes and no. So there's not a 3 strikes you're out situation. There is, anytime that we have an aggressive resident, whether it be towards a staff member or towards another resident, that is documented. We have assessments that are done for that resident. We try to prevent that and look at the root cause of why it's happening.
Okay.
Whether it be they need a change in medication, whether it be that they're in pain, that might be
Right.
part of it. We look at the environment. Is there some way that we can prevent this without having to have any other situations occur or, yep. So we work really hard to do that. If it is a case of a resident to resident situation, that is also reported to the state of Wisconsin, just like any of the other things. And we would go through that same process of notifying law enforcement, calling the families, POAs, all of that stuff, and doing the state investigation as well, just like if it was a staff to resident situation.
Okay.
And then if there is a situation where we truly do not think the person is fit to be at our facility, whether it is that they are not appropriate there because they are a risk to themselves or others, we can start going down an involuntary discharge process. So if we truly think that they are a harm to either themselves or another, that is one of the reasons that we can discharge someone. There are very few reasons where we can try to discharge someone without them wanting to leave. And that is one of them. The kicker with that is we do have to find a place for them to go. So we cannot discharge them, and the hospital is not an option. Like in an emergent situation, we can have someone discharged to the hospital, but they typically come back to us after that. But sometimes we're looking at sending people to a behavioral health unit if that's possible and things like that.
All right. Well, thank you. I didn't mean to kind of get
That-
too drawn out, but.
Well, even starting from the vultures, we learned something when we have. Do you have some more questions on the vultures?
No, I pretty much covered it all there.
Right. I'm just curious, I probably asked before, but the Matrix Care Inc., maintenance contract.
That is our EMR system, so electronic medical records.
Okay, thank you.
So that would be so
Yeah.
if it's a large one, that would be our
Yeah,
annual
that's,
payment.
I look at okay, that was the next question, annual. Okay, any other questions on the vouchers? Okay, we have looked at the vouchers and the financial reports. I would take a motion to accept the vouchers and financial reports. Supervisor Witzel and, okay, and
second.
Supervisor Lino. All in favor? Aye.
Aye.
Any opposed? Okay, that'd be it there. And we have a meeting, next meeting is, you're
April.
planning on being here.
Yep, April 25th.
Okay,
And I believe that meeting, I should double check, but I believe it'll actually be in the room next door. This room had something else, like an all-day training going on that day. So I believe our committee and then I think it's Committee on Admin is also on the same day as us.
Yeah.
Are next door that day because this was booked.
Okay.
okay. I have one announcement. Anybody else have any announcements or anything?
I would just like to ask, can you share about the closed meeting that took place last month, the status of what's going on, or can't you share that?
So that was, what was going on was what was in the East survey update. So
Oh,
that
okay.
that was related to that situation.
Okay, let's see now, Supervisor Breslin isn't here, but officially I'd like to thank him for being on for these 2 years. He chose not to run again, and I thought Sean did a nice job. And I'm the only one that's running unopposed, so I'm probably gonna be back. Maybe not on this committee, I don't know. But you three are all have opponents.
Yes.
So I want to thank you guys, or just on recently, but thank you anyway for being on. And Corlee, you've been on the whole time and I've gotten to know you a little better, and I think you've done a nice job. Yeah, she's giving me a hard time all the time, but I went to the conference down there and so forth. So thank you all for being on the committee and getting to see what wonderful staff we have.
Yeah.
And we are adjourned.
Yeah, I was going to say, I really enjoyed it. I've learned a lot even since I was a CNA like years ago. So it's been, but thank you, Carmen, for all that you do. Really appreciate it.
Okay,
And I just want to say how much I admire what a great job Carmen and her staff
Yeah,
do.
I
They
don't know
are
how she
just
does what she
so
does.
impressive and
Yeah, it's a lot of work.
been bragging you up when I'm out there talking to people.
Well, I appreciate it. Thank you.
Thanks, Bruce.
Wonderful. Okay. I think we're adjourned.
You're good.